Hello, I'm Laura Wright, and the article I'm going to be discussing was found on the Lexington-Fayette Urban County Government website. It's entitled Lexington Sues Drug Wholesalers and Manufacturers. This article discussed some of the steps that Lexington was taking in regards to combating the opioid crisis in the city, and that was in the form of a lawsuit against some of these manufacturers of these opioids. Lexington and Fayette County specifically is the 35th county in Kentucky to actually file a suit like this. The article discussed some of the major concerns with the opioid crisis in Lexington. A lot of those revolved around costs. About $1 million each year is spent on treatment programs at social service agencies like the Chrysalis House, which serves addicted women, at the jail, and at shelters for the homeless. And even though there are these treatment programs out there, the waiting lists to get into these treatment programs are huge just because of the sheer volume of people in this city that need help with their opioid addiction. Another concern was the cost of Narcan. Not only is Narcan becoming more expensive, but the use of Narcan in Lexington is growing. It actually doubled between 2013 and 2016. Another concern was the needle exchange program. Lexington spent about $150,000 a year on this program, and they did distribute more than 332,000 clean needles and received more than 281,000 used needles. However, when you look at overdoses in Lexington, it actually is number 2 in the state of Kentucky for heroin and fentanyl related overdose deaths. The article closed with talking about how the city is also hoping to start a trust fund so they can put greater efforts into prevention and treatment programs for opioid addicted individuals in Lexington. The opioid crisis affects me daily as a nurse. I work on a med-surg unit, and there hasn't been a day that I haven't had at least one patient that is struggling with addiction. Specifically, I do see a lot of heroin and fentanyl related addictions, just like the article talked about. Those were 2 of the main overdose deaths. We rank second in the state. Drug addicted patients present unique challenges to nurses because you can't just treat the medical condition and focus on the medical diagnosis. You have to treat the addiction in all that you do. And these patients tend to have a lot more mental illness, and so you collaborate with behavioral health to not only treat the addiction, but to treat some of the mental health problems that could have led to an addiction. We also have to look at the complex challenges with detoxing a patient and everything they go through when they're trying to get clean. And a lot of these patients, because they're addicted, are going to try to leave the hospital. So as a nurse, you take great responsibility for trying to influence a patient to stay and receive the treatment that they need. Also, a lot of our efforts focus on education, not only teaching the patient about the risks of drug addiction, but helping them to understand the entire cycle of addiction and the different stages they're going through when trying to fight addiction. And just overall, these patients tend to be much sicker. They've been exposed to more disease and lifestyles with greater violence. And then when we're discharging these patients, it's challenging to get them into the appropriate rehab facilities, not only to actually get them there, but to get them into the programs. Because like the article said, the waiting lists are extensive. The pain management strategy that I picked that's not an opioid strategy is exercise. And the reason that I chose exercise as my non-opioid treatment is because it's not a pharmaceutical. So many of the non-opioid pain management treatments that are used are another pharmaceutical. And although things like Suboxone therapy can be very effective for patients, it also can present just another problem for them. They have to have it. They need to get into the clinics. They can run out. Or if patients are given nerve or anticonvulsant pills or antidepressants to treat their pain, again, they're seeking another pharmaceutical. So my ultimate goal would be to reduce the use of pharmaceuticals and have patients develop a more holistic and alternative way of thinking and living and have different alternatives to taking a pill to help them feel better. Exercise is a strategy that directly helps to improve the entire person, spiritually, mentally, emotionally, and physically. And the main thing I like about exercise is its impact on the mental state of people, because everything you do is affected by your state of mind. And if you have a healthier mental status, then it's very likely you're going to have greater overall health outcomes as a person. A study completed by Gordon and Boxam found aerobic exercise helps to treat pain by increasing blood flow and nutrients, which in turn promotes healing. Exercise also helps to improve flexibility, which can reduce pain because you're not as stiff. They specifically went on to say that 30 to 40 minutes of aerobic exercise increases the body's production of endorphins, which is a brain chemical that binds to the opiate receptors in the pain control system in the brain and the spinal cord to decrease the perception of pain. And endorphins act in a similar way to pain-reducing drugs such as morphine and codeine. So these are some of the reasons that I focused on exercise. So in terms of my teaching plan, I was looking at using exercise for pain management and the prevention of pain. My target audience is patients that are 18 and older being seen in a mental health facility. I found it interesting that Trevor McDonald with the Mental Health First Aid Organization stated that over 40% of people living with addiction also have some other form of mental health problem. And a study completed by Family and Community Medicine with St. Louis University School of Medicine said that the longer you use opioids, the more likely you are to have new onset depression. And they specifically looked at people that used opioids greater than 30 days. So, and another concern is that often depressed patients lack the energy to participate in exercise, which in turn makes their pain worse, and they have more depression, and it's just a never-ending cycle. So my goal is that after viewing this presentation, patients will verbalize the importance of exercise for pain management, and again, pain being mentally and physically, emotionally. So in terms of the cognitive realm, patients will verbalize 4 benefits of exercise to the nurse by the end of the shift. And the patient will also verbalize 2 ways in which exercise could improve their specific current problem they're experiencing with pain. In the affective realm, the patient will read education material to the nurse by the end of the shift, and the patient will verbalize to the nurse 2 potential problems that could hinder them in being successful with an exercise program. And this will occur by the end of the visit. In the psychomotor realm, by the next visit, the patient will journal how they feel before exercise and after exercise 3 different times. And then they'll bring those journal listings to their next visit. And also in the psychomotor, the patient will schedule and go to a tour of one of the Lexington gyms. The way I'll evaluate if this education was effective in the cognitive realm is learning will be evidenced if the patient can verbalize the 4 benefits of exercise to the nurse and can also verbalize 2 ways that exercise can improve their current problem. In the affective realm, learning will be evidenced by the patient accepting the educational material provided and reading that out loud to the nurse. And if the patient is able to identify 2 obstacles that could hinder them with an exercise program. In terms of the psychomotor realm, learning will be evidenced by the patient bringing 3 before and after exercise journal entries to their next visit, and if the patient did actually go and tour a Lexington gym. The handout I created is posted below this video, and I'm going to go over that now. I put at the top of the handout, increase exercise and decrease pain. I quoted the Centers for Disease Control and Prevention when they said exercise therapy can address posture weakness or repetitive motions that contribute to musculoskeletal pain, reduce lower back pain, and improve fibromyalgia symptoms, and reduce hip and knee osteoarthritis. Then on the side of the handout, I discussed some of the main benefits of exercise in terms of treating pain specifically. Often exercise can give quick pain relief. It improves mental health, improves mobility, pain prevention, promotes a healthy weight, and it promotes the release of natural opiates. Specifically, I put on there from an article that I read in a healthcare journal. It was an article entitled "A Systematic Review of the Effects of Exercise and Physical Activity on Non-Specific Low Back Pain, Chronic Low Back Pain." They recommended 30 to 40 minutes of exercise daily, which I put in the middle of the handout. Also, I put at the bottom of the handout to talk to their doctor about physical therapy, because according to the Centers for Disease Control with the Department of Health and Human Services, people working with a health provider have greater success using exercise to treat pain. I recommended that they talk to their provider about physical therapy and getting with a physical therapy program. However, I wanted to just put the point that working with a health provider in general could help increase their success, because this health provider can talk to them about the barriers to completing the program, can give them ideas for resources, and overall just help them be more successful. So again, that is my handout, and it's posted at the bottom along with my references. Thank you.